were in charge of all the physio. They've done all the physiotherapy. At home, usually the parents, or if they were a bit older than adults, their partners would do all the physiotherapy for them. So from the patient's perspective, it was quite a passive thing. They didn't do much. And it also could, especially for young children, it could be quite a torturous thing. If you've ever seen the old-fashioned treatment getting done, it's quite torturous for some of the young children. So a big move in recent years has been to give the patients control of the therapy. So my aim is at preschool age is to have the patients doing their own therapy. Now they need the interaction from their parents or from us as physios to do that properly. They can't just be given the equipment at 4 or 5 years old and go away and told to do a physiotherapy. You need to sit and make up the games with them and have like wee score sheets or have targets or things for them to aim cotton wool at if you're blowing cotton wool. So they need a lot of interaction. And we've found that they keep it at hospital much more with being in charge of their own therapy and other treatments that have come on stream as well. So the onus certainly is on the patient with the family supporting to do their therapy at home and to allow them out with their therapy regime to lead as normal a life as possible.
And how long do you on average as a hospital see each person for? Is it until a certain age or?
We transfer our patients at 15 years old to the adult centre. 15 is more uncommon to transfer a patient. Most centres transfer at 16 or even a wee bit older. I think 15 is an ideal age to transfer personally, and I used to work in the adult centre, so I've got a perspective for both sides. Things change as you get older, and with the best will in the world, we have a tendency to still treat our teenagers as children because we're a children's hospital, but there is a lot of implications for cystic fibrosis into adulthood, and it's very important that those issues are dealt with by the adult team. So we transfer at 15 years old, but they go through a year or so transition of getting to know the adult team. So we don't just one day see them here, then the next day they're in the adult service at the adult centre. We have a year or so of transition, so they get to know everybody first.
It's clear that you obviously see the youngsters for quite a long time. Would you say that close relationships are formed with each person?
Yes, that is always a big problem for physiotherapists. There's a whole team of professionals that work with cystic fibrosis. We work very closely with other members of our cystic fibrosis team, but the physios spend more time than any other member of the multidisciplinary team with the patients. We're spending, if they're in unwell, you can be spending several hours a day with one patient. So you've kind of in a way got no choice but to have a close relationship with them because you're spending that amount of hours with them in a day. So as a physiotherapist and as a professional, you have to make sure that relationship stays in a professional way. And that's very difficult if you're working with a 5 or 6 year old child. You're trying to create a relationship with them, quite importantly create a relationship with the family, and you're possibly also asking the child to do things they don't want to do. So you have to be good at coaxing the child and coaxing the family along to do things they might not want to do, but it's in the best interest of the child, and also keep a relationship with that family and that child, because if your relationship breaks down with that family and that child, it doesn't matter how good you think a physiotherapist you are, you're really going to struggle doing anything with them. So you do create close bonds. It's important that you do create that relationship, but it's also very important that it remains professional, and you try not to overstep the bounds into having a personal relationship with your patients and families. It can be very difficult to do.
In your time within your position, would you say that the general practices have changed or evolved in a way?
Yes, even 10-15 years ago in cystic fibrosis, the practices not only in physiotherapy, although that's what I'm primarily interested in, but and from nursing and dietetics and medical point of view, they have changed enormously, and subsequently the outcomes for our patients and the quality of life they get has changed enormously as well. There's been huge moves. When I first started working in physiotherapy, as I've already explained, the treatment was all very passive. The patient essentially lay there and got treatment. Now the kids we see, they're very involved in the treatment, they're very active. They're at the centre of the care and they're in charge of the care. And one of the things I've said to the other physios work with is we're trying to give the patient ownership of their therapy. That's what we try and do. So it's been a huge move away from that passive treatment to be more active and having the child at the centre of that treatment and being in charge of it. And it's not unusual, and it's a good thing if our patients say to us, I don't usually do that, I do this is the way I usually do it, and I try and encourage the kids to be involved in that, and if we do something a bit different, they should be questioning what they're doing. Others, some are better than others at doing that, of course, but there's been huge improvements in care and outcomes subsequently for our patients.
To sum up, from a personal point of view, what would you say are the most challenging parts and the parts that you enjoy most of what you do?
Well, I suppose like in our profession, the most challenging parts end up being the most interesting parts as well. Possibly the most challenging parts of your treatments, of your intervention, is doing things that the family don't necessarily agree with what you're doing, or the child doesn't want to do. And like any other parent, you want to protect your child. So if you as a physiotherapist go in and you're upsetting the child, the family immediately want to protect that child, of course. That's only natural. So that's the most challenging part. But if you can see that through, and again, one of the phrases I try and use to the children, as I say, I want to be nice to you, but I'm not here to be your friend. I'm here to be your physiotherapist and to look after you and to make you well again. So that's one of the phrases I use with them if I'm trying to convince them to do certain things. But if you can see that through for a period of 2 or 3 weeks, and get where you want to go with your treatments, that is the most rewarding part. Because what happens is that the child and the family then see the results you can get with your treatment, and then they all come on board. There's a negotiation to be had and a bit of give and take to be had through that, but if you can take a family through something where they sometimes quite vocally tell you what they don't agree with what you're doing, if you can take that family through that process and at the end of it show them how much progress they've made, and they can then maintain on their own at home with input from us continuing, of course, but mainly at home on their own, then that's the most rewarding thing, and give them a much better quality of life from that. It's the most rewarding thing. Overall, the most rewarding thing in my job is seeing the children I work with just having a normal childhood. That's the most rewarding thing.
Thank you very much for your time.
Okay.
Thank you.
That's quite alright. Oh, your mum's there. I was going to show me over. Turn that off. Okay, Shireen?